So now let me introduce our special guest here, give a little bit more information. Helen, Dr. Helen Webberley is, as I said, the founder of GenderGP, and she's a fierce advocate for the transgender community. Helen is committed to reinventing healthcare for transgender and gender diverse people. During her career, she has always been a strong believer in equality for all, and she's passionate about erasing discrimination from healthcare. As well as her medical degree, Dr. Webberley has a higher qualification in sexual and reproductive health and a psychosexual medicine specialty. She spent 20 years working in the NHS with a particular interest in women's health. The move to providing medical care to the transgender community was a natural progression for her and of her skills, and it's an area of healthcare that she has found very rewarding. So, Helen, welcome again.
Thank you very much. Thank you for a lovely welcome.
Marianne, the lead therapist for GenderGP. She is a fully qualified counselor with a postgrad diploma in gender, sexuality, and diverse relationships. And she's the most experienced counselor in the field of transgender care for GenderGP. And she heads the team of specialist gender counselors at the GenderGP. And Marianne combines her own experiences as a trans woman with her affinity for those in their own gender journey. She came into this particular branch of the therapy after struggling to find somebody who could support her with her own transition. Marianne brings a unique insight into her practice, both from her own firsthand experiences and her understanding of the impact which transition can have on families and loved ones as well. Marianne enjoys working with people of all ages, including children and their families, creating a non-judgmental place and space in which parents can talk openly about their own issues in relation to their child's transition. So thank you, Marianne, again for joining us.
Thank you. Oh, what a lovely intro.
And last but not least, Dr. Capitán. For those new to Facial Team, Dr. Capitán and his colleague, co-founder and co-director, Dr. Simon, began Facial Team in 2010, so just over 10 years ago in Marbella, Spain. A decade later, their team has grown to an integrated group of about 50 multidisciplinary professionals dedicated to facial gender surgery patients. Under Dr. Capitán's direction, Facial Team's achievements include over 3,000 facial feminization procedures performed, and with over 8,000 patients who have benefited from our free consultations and orientations on 4 continents in the last decade. He forms part of the research and development of Facial Team, which has award-winning research and 18 published scientific articles in leading medical journals. He's the founder of one of the first FFS training programs in the world, launched in 2018 to train future FFS surgeons in conjunction with leading medical institutions such as Johns Hopkins University, Mount Sinai, and the American Society of Plastic Surgery. So on top of that and many technical informations in FFS under Dr. Capitán and Dr. Simon's leadership, Facial Team is active in raising visibility of gender-affirming surgeries. He is on the surgical work group for the revision of the 8th edition of the World Professional Association's Standards of Care, which is now in its 8th version. It is the equivalent of the best practices of the World Health Organization, for example, but within this sector. And it informs the Global Trans Health Provider Network. So it's a very important document. Thank you, Dr. Capitán, for all that you do and for being with us again here today.
Thank you, Lilia. It was a very nice introduction, and I'm very happy to share today this live with Marianne and Helen. So thank you, both of you, for your time. It's going to be very nice.
Yeah.
So I'm the host today, but I'm going to try not to interrupt as much as possible. And I've been authorized to interrupt to just introduce the questions from our viewers. I'm not being rude. So please do, again, send your inquiries in the comments here below, and I'll bring them up as we go through our discussion. Today's topic includes telemedicine, or a virtual model of patient care, which provides direct access to care based on informed consent. So we'll be talking for about an hour, okay? So please let us know your questions. And so to start off, I'd just like to say we're all actually right now in Spain, even Helen, except for Marianne. Marianne, where are you?
In the UK, in the Peak District in the UK. So I'm sure the weather's not quite as warm as where you are.
Well, if you can see the beads of sweat on my forehead, it's very, very warm here. We're down on the south coast of Spain. And the breeze today is like a hairdryer rather than a fan. So very, very warm here today.
And Dr. Capitán, are you in Marbella?
I'm not. Today I'm in Granada. And I came to my daddy's house because, you know, at home we have all the kids. And with all the kids is quite a mess to do a live. So now I'm very quiet here.
Yes, it's completed. I'm also here from home, since we are practicing telemedicine, and so with the pandemic, many of us are still working from home, and so I'm quite comfortable here with the family, otherwise occupied at this moment. So I would like to start off, if possible, by talking about the GenderGP podcast. Recently, Marianne and Helen, you had a series of podcasts focused on facial feminization surgery, and so you interviewed Alexander Hamer, the gender analyst. You also interviewed Dr. Belinga, one of our surgeons, and you spoke with Dr. Simon in a podcast separately with one of our former patients. Could you tell us a little bit more about the interesting things that came out of that series?
We had a really, really good response to the series that we did. As you say, we did the three podcasts. The first was with Alexander Hamer, and she was talking about the way that with the facial feminization surgery and the expectations and the desires and the wishes that people might have, and how she uses computer software to take, you know, really detailed photos and show people what the goals and the achievements might be for them. And it was just so inspirational. She's obviously so dedicated to her work. It was amazing. We then talked to Dr. Belinga, and he told us in great detail about the operations and how they were carried out. I learnt loads, and I have to say I had to hold my hand up to my surgical colleagues and say, goodness gracious me, I don't think I could do it, but just absolutely amazing techniques that have developed. And when you were talking to Dr. Capitán and introducing him, and I think the techniques that Dr. Belinga was telling us about have developed through experience and research and passion. And I love the way that your team is using that to educate new people in the field, and that's just something that we need so desperately. And then we had Dr. Simon with Stephanie, who was a very happy former patient of yours, looking absolutely as feminine as she wanted to be, so as she wanted to look. So, you know, it was really lovely to hear it from the other side, from the patient's point of view, because it's very easy as a healthcare provider to kind of get locked into providing and not seeing the experience. So it was really lovely to talk to Stephanie and hear her glowing reports of her experiences with you. So we had such a good response. Anyone who hasn't listened to the series, I urge you to have a listen. We had a really good response. People had heard we were doing it, and then they were messaging going, when's it coming out? When's it coming out? Tell us. So it was really, really good, and we love doing it. I love doing podcasts where we learn. And it seems, you know, when you think you kind of know a lot, and then you meet some new people and you learn so much. I don't know about you, Marianne, but I really, really enjoyed those three podcasts that we did.
I have to say, it was an area really of transition that I'd obsessed about when I was younger. You know, I obsessed about facial surgery way beyond anything else. As I've got older, that had kind of drifted off my radar for whatever reason. But actually talking about it, I realised how can I say how important it is for a lot of trans women still, that it brought it back into my awareness. And it's, like I say, it dropped off my radar, but listening to how how you develop the techniques and minimal scarring. And, you know, I'm sure at one time people were, was it having facial surgery and looking like they've had facial surgery? Whereas the techniques now are obviously, I don't know, from what I'm seeing, as pure as they could be, as natural as they could be. So, yeah, so I was just interested listening to our own podcast.
You know, you've done a good podcast when you listen to your own and you're interested by it. So that's really good.
Thank you so much for including us in that podcast series. It was very interesting. We've gotten really positive feedback also from that, as we are now with these lives. People are really appreciative that we're bringing this information, just like your podcast, directly to the people. So I also enjoyed listening in to the podcast. So I also would just like, before we really get started talking about telemedicine, Helen and Marianne, if you could give us a little bit of history, the vision and the values behind GenderGP, and maybe highlight some of the data from your 2019 annual review, which you have up on your website, which is very interesting. Could you tell us a little bit more about how GenderGP has been developing over the years?
Yeah, sure. I mean, I don't mind starting. As in your introduction, you explained that I'm a doctor that is very passionate about equality in healthcare, and my sexual health training it started in the era when HIV was just beginning to brew. That when I was a medical student, HIV was coming out, and everyone was like, "What's this infection, and why is it targeting groups like homosexual people or IV drug abusers? What is this infection?" And then, of course, in that time, the genitourinary medicine that helps HIV positive people developed, and I was a big part of bringing genitourinary services into mainstream medicine, so that it wasn't in some back alley. This was in nicely, brightly lit sexual health clinics. And bringing equality in there. So I know that it can be done. And in my early career, I felt like everybody else, where I'd never met a transgender person before, or I thought I'd never met one. And then in my career, when I'm the kind of doctor that is I'm passionate about that kind of thing, and I think patients kind of sometimes spot that kind of doctor. So I had a couple of transgender patients come to see me, and they told me about the access to healthcare for trans people. And I didn't really believe it, but when I started looking, I was like, oh goodness, this is really bad. This is really bad. And so I started to do some more research and some more personal education for myself. And then I just uncovered more and more terrible stories about people trying to access healthcare for transgender health. And that, if we roller coaster forward by 5-6 years, here we are today with a very, very big organization, which used to be based in the UK and is now based worldwide, helping transgender people. So, and as Marianne will tell you, we don't just help trans people, but we're passionate about helping and educating and informing anybody whose lives are touched by a trans person. So a trans person themselves, or their family, or their school teacher, their boss, their co-worker. There's so little information available and so much misinformation that it's become our passion and our drive to A, improve healthcare, but B, to improve education, which is why I'm really excited about hooking up with you guys, because the education is so important for you as well. And that's the thing that I really like, as well as helping patients. It's educating others to come in and help, because we need more people in this field. There's no doubt about that.
Well, thank you for that. It's exciting to work together with you as well. Marianne, do you have anything that you'd like to add in terms of the mission, vision, values behind GenderGP in your particular role?
Yeah, without question. Something Helen didn't mention there was the approach to transgender healthcare, which is gender affirming. And I'm conscious, until I met Helen, I'd never heard of gender affirming healthcare. They have a model of care in the UK that is very much about gatekeeping, and this idea that you could go on the journey and do it your way and do what's right for you. It just blew my mind. So as soon as I got involved with GenderGP, I don't know if Helen remembers, but really I was just nibbling away saying, I want to be involved, I want to be involved, want to be involved more, I want to be involved more. So, and then as it grew, when we ended up with a team of therapists, I kind of became the lead therapist. And actually the values that Helen has shown me, because like I say, I'd never come across a gender affirming care, that's just expanded. I think I've kind of bounced it back the other way, and we've expanded what we mean by that and the way we are helping families. It's not just about helping the individual, it's anybody, as Helen said, anybody involved with a transition of any kind, we're there to support. So
Lilia, hearing Marianne and Helen, I mean, you are truly game changers in trans health care, and this is so important because I mean, you can write papers, you can read papers, you can do whatever, but at the end of the day, our patients, they need people like you supporting and counseling day after day, because well, you know, the journey is so long, so tough in most of the time of the something. So I really congratulate you. I mean, hearing you and looking your passion is something remarkable. Congrats.
Absolutely, I agree.
Dr. Capitán, is that we have the ingredients that we have to work with. The patient group that we work with are just such a lovely patient group, and I think I can confidently say I've never worked with a more rewarding patient group than
I totally agree. I mean, 200%. I mean, I've never seen these kind of people that they show gratitude all the time, and is unbelievable. Yeah, I agree.
So to move into the topic that we want to discuss today, you know, these live streams, the podcast that you do, and the online services we provide with this passion that Dr. Capitán is talking about, are all part of telemedicine, which, as our title suggests, seems to be coming of age finally, due to, in part to the pandemic, which locked us all up in our houses, and we were forced to do these kinds of things. So we're seeing it as sort of a shift now in the paradigm of the way people see these kinds of services. Before it was sort of secondary, now it's really moving to the forefront compared to traditional healthcare services, which requires you to go face to face. And so, Dr. Capitán, would you mind beginning by commenting a little bit on how long has telemedicine formed part of Facial Team services, and roughly what it consists of?
Yeah, maybe during my speech, I will share my screen if it's not a problem, so I can show you a few graphics of the evolution, right?
Yes, sharing capacity.
Yeah, from the very beginning, we understood that many of our patients were from abroad, basically because this type of services were very basic. I mean, in Europe, we had no real places for facial surgery in terms of gender. So we understood from the very beginning that all of our patients, I mean, 90% were coming from abroad. So we had to establish a way of communication. Otherwise, the personal interaction was completely impossible. So let's say that 10 years ago, Skype already was there. I mean, Skype or whatever, any of the platform, we started with these video calls. So now I'm going to share my screen with all of you. Please let me know if you see my screen.
We see it.
Can you see telemedicine numbers?
Yes.
Perfect. We don't have so very rigid records of what happened 10 years ago, okay? But if we look here, okay, you see a Skype consultation, okay? Let me clarify something. we have 3 types of a Skype consultation. We call it a Skype, but it could be wherever. I mean, Google Hangout or any type of video interaction. We have been using Skype for many years, and we like it very much, okay? So there are 3 types of a Skype consultation. We have the medical Skype, or the medical video call, where the patient can talk to the doctor of medical or technical issues, okay? Then we have the video call, the video consultation with any member of the staff, normally coordinators or psychologists, okay? And then we have the post-operative video call. This is the video call that the patient have once she has returned to her country and they need any kind of follow-up, okay? And they do this video call with the post-operative department. If you look to the graphic, okay, this is a Skype first consultation. So this is the number of video calls with the first video call with the doctor, okay? If you look to 2012, in our records, we have 2, okay? If we go to 2018, we go to around 400. And then in 19, we go to 475. But if you look to 20, where we have had the crisis, we are reaching the number of the 19 only in 6 months. Of course, during the crisis, the interaction and the number of video calls really increased a lot, okay? And probably this is something common for everybody here, okay? So we can conclude that the telemedicine for us is something totally inherent to our activity. Now we cannot live without the tele-interaction with our patients. And we are trying to establish protocol that allow us to make this video interaction more strong and more solid, okay? Because at the end of the day, we are changing the philosophy of medicine. I mean, medicine was something very face-to-face. Now we are doing face-to-face, but with a screen in the middle and with 1,000 kilometers of miles between the patient and the doctor. And we have to contribute with something very solid and very strong. And this is what we are trying to do nowadays. If we go to the next, this is from January 19 to May 20, well, the average monthly Skype consultation with a big peak during March 20, where we have to totally close our activity because of the crisis. And then we focused very much in our Skype interaction with our patients, okay? And then, oops. I want to show you this post-operative consultation. This is an average number every year of Skype consultation during the follow-up. And this is very interesting. If you see the number is, let's say, quite reduced if we compare with the total number of video calls. That means that the facial surgery, for different reasons, is something very predictable. When I say predictable, it's something that you know what to expect from the surgery. And this is something very important for the patient, okay? Because they are not entering any adventure, or they are not coming for something magical that is going to happen. They know what is going to happen, and they know what to expect in the follow-up. And these numbers to me are very interesting, okay? As I said, monthly, and the total Skype consultation, remember, including the 3 types: the medical consultation, the staff consultation, and the post-operative consultation, with the number of 800 in 19. That is, let's say, our peak in terms of Skype interaction. So now I'm gonna stop sharing, and I poke a lot. Okay.
Oh, thank you, Dr. Capitán. It's very interesting. And in one of the viewers is saying that based on the numbers and the graphics from 2017, it seemed like the trend would have made 220 this year. Numbers easily in the mid 500s, and from that last screen you showed it, we're only halfway through 2020 and we've already superseded over 500 Skype consultations. So
that's correct.
Yeah.
So in summary, telemedicine is something absolutely basic and inherent to our activity.
Yeah, I think when I agree with you, and obviously you've used it right from the beginning, which is fantastic. I remember when we were started GenderGP, people were saying you can't do that, and we were like, you can, and we broke the mold in so many ways. Marianne was talking about gender affirming care, so allowing transgender people to have input into how their care was given and developed and how their journey was, and then using the power of the internet, which we use it so much every single day, and we were not using it enough in healthcare. And people were saying, well, you can't do that. How can you examine somebody? How can you look at them? How can you properly explain? What if there are safeguarding issues? But actually, being able to talk, we look at us all talking like this from across the world. Marianne's 3,000 miles away from us, and we're talking, really, really easily here. And what it allows is, it allows that doctor like you into somebody's home, in the comfort of their home, in the security of their home, to go through things at their pace. And I think it's really, it can never be underestimated how valuable this is. And particularly for the transgender community, where sometimes it can be a little bit scary going out, going a long distance to a clinic that's many, many miles away, or many, many continents away. That's, it's scary for anybody. And just to have that availability to talk personally to your doctor, so you can suss them out, so you can see what they're like, so you can trust them, is just amazing. And, COVID hasn't done, nobody wanted the pandemic and the difficulties that we've had, but what it has shown is that, yes, telemedicine is here to stay, and it's really important and so valuable for a community such as the trans community. And it's interesting, because what do they call it? Healthcare abroad has been here for a long time. We've talked a lot about going for dentistry or for cosmetic surgery, to Europe and what have you. But there's always that unknown, isn't there? What are you going to find when you get there? And telemedicine opens up those doors. And Marianne, I mean, people have said to you, haven't they, that you can't do counselling. How can you properly understand somebody's feelings and emotions via a computer screen? But what do you think about that? Is that true?
Oh, without question, counselling can work perfectly fine over the internet. It can over the phone. What it does mean is sometimes, and I'm sure you as doctors, sometimes you just have to be a little bit more switched on. You have to pull on sensors that you probably wouldn't normally use. But that doesn't mean to say that the outcome is any less than if you were in the same room as somebody. I used the example recently when I felt I was having to defend it to a group of counsellors. I said, so what you're saying is that if you're blind, you couldn't be a counsellor. When actually there's no reason why you couldn't be a counsellor. You pick up on these, we're trained to pick up on what people are saying. I just wanted to expand though as well. The other thing that I was thinking of while the intros were going on, that when I think about the amount of people we work with, Helen, the quantity of people, that if we had a bricks and mortar building fixed in one area of the country, we would probably have less than a quarter of the patients that we could work with. Telemedicine's meant that we can work globally, and that to me just blows my mind for a person of my age.
In one of the comments from our viewers, Elodie, thank you for coming, Elodie. She says that it's something the NHS should have been doing years ago, particularly with the gender identity clinics. Do both of you think that public health services will start to catch on and use telemedicine like GenderGP and Facial Team have been doing now for years. I remember when we first started, we used even, I think, a Yahoo chat and Messenger in the beginning. We tried various different platforms, and I felt a little iffy about it too, but really patients latched right onto it, and they said, this is great, you know, particularly in what we would consider, you know, medical tourism. So it's not always possible for us to see each other face to face, despite the fact that Facial Team does do events in other countries on a regular basis, but we can't get everywhere. So this has been a great way to reach out. So what are your thoughts on that aspect?
Well, it's funny, isn't it? Because the NHS, the UK National Health Service, has been thrown into telemedicine quicker than it wanted to be, I imagine, because of the current situation. So doctors and consultants, nurses have been doing telemedicine without even the training that would normally go in. So it'll be very interesting to see what happens afterwards. You know, do they go back to the old ways, like Marianne was saying, with a traditional long train journey and then a long waiting list and a small waiting room with not enough capacity? Or do they keep this model which allows accessibility? But I think to have that accessibility, you have to want to be accessible. And maybe that sometimes having those barriers that we've talked about, the political barriers, the social barriers, the geographical barriers, the economic barriers, maybe they limit accessibility, and maybe that's in some ways what is wanted. Whereas for me personally, you know, the more trans people that have access to help support medication, surgery, if that's what that is needed for them to live happy lives, then that's so important to me. Just to make it accessible. It's not fair for it to be a postcode lottery, or done by age, or done by affordability, or geography. It's not fair. So telemedicine allows that NHS gender clinic to happen in your living room. And the most beautiful thing is, if you get uncomfortable and you don't like something, you can just pretend your internet went down and you can switch it off. Whereas actually leaving a consulting room when you're being asked awkward questions might not be so easy. So I really, Elodie, I hope that the NHS carry on with telemedicine, and you know, we would be so willing to share our model because it's clearly worked.
If I could just add, being a patient of the NHS, I couldn't agree more. The you know, the booking time off work, you know, if you just look at the statistics, we're vulnerable, and they want us to go out to a clinic to meet somebody that's going to try and make you validate your gender, and you're going to be facing all the public on the way there. You'll be really nervous. Just the build up to go and have one consultation, they give you like 30 minutes, and the time it takes and the effort it takes. For a trans person, if they can sit in the comfort of their own home with their own surroundings, without having to face all that, you're going to get a more genuine consultation. You're going to get somebody who's more relaxed. They're still nervous when they come on, but it's very easy to calm them down and relax them. You know, if they've got a favourite teddy or whatever. I just think, you know, if we agree they're vulnerable, you know, that's the common thing we hear, but also the statistics show that earnings are lower than average. You know, a lot of them are on benefits, they're not able to go to work, so then to pay to have to get to the consultation, it just cuts through all of that. I think it does anyway.
Absolutely, I agree. So on that topic, I think it's a good segue into talking a little bit more about the details, exactly about how we're able to manage expectations and provide information, even more detailed, better information with telemedicine. So Helen, Marianne, I'd like you to maybe comment a little bit more how GenderGP provides exhaustive information about your services, your portal, right? I'd like to hear more about that. Could you tell us?
Yeah, sure. So, you know, information is really important. And what we're talking about here, whether we're doing medical work or whether we're doing surgical work, is informed consent. And informed consent is a two-way process. So the patient or the service user needs to have enough information to make their decisions that's going to be right for them and particular to them, so they can make decisions that is exactly right for them, not right for the herd, but just right for them. So they need enough information. And then the doctor or the therapist or the surgeon, they need enough information about that patient. And when you were talking about the digital way that you do the MRI scanning, and making those photographs, making the 3D model of a before and after, that information is so important for people to understand, to know what might happen. And then you've got the other type of information which we have to give. We have to say, listen, if you take a medicine, there might be that these are the things that could go wrong. These are the things that don't go wrong very often at all, but they're quite serious. And these are the things that might happen a bit more often, but they're not too troublesome. And the same with you, your consent forms have to be robust. They have to protect you as doctors and surgeons. So we've got to get all that information both ways. We've got to learn about the patient, and the patient's got to learn about the medical bit that we can share with them. So informed consent is a really important part of any medical procedure. And I think what the internet and digital healthcare and telemedicine allows us to do is to have a combination of all those things. So check your email box, and I'm going to email you a load of information leaflets, consent forms, have a read through and come back to me next week and see whether you've got any questions. I'm going to send you some photographs to have a look at. This is what you might be achievable for you. Have a look and see whether that fits your expectation. And then maybe some forms that need to be signed. They may need to say, well, I need some time to think. Don't rush me, I need some time to think. Have as much time as you like, and email me the forms back. And we can meet again in a couple of weeks. If we didn't have telemedicine, all that would have to happen really in one sitting, at one consultation, especially if you're talking about distance and medical tourism, as you were talking about. So, informed consent, where you have so many different ways of sharing information between the practitioners and the patients, and telemedicine, the internet, the digital age allows us to do that really, really well. Marianne, I want to pass it over to you because I love the concept that when we're talking about assessments for transgender people and how that's irritated us in the past, that kind of assessment idea. And I know that you share my views on that, but
I suppose the biggest role that the wellbeing department play within GenderGP when people are moving forward towards treatment is we gather the information, and it's kind of been 5 years in the making, hasn't it, Helen? I don't think you disagree with that we started off doing an assessment, and then we decided we didn't like the word and we played with it. We've got information gathering session now, and I don't think we necessarily believe that's the finished article. But what we're really doing, going back to what Helen was saying, is this patient informed of the journey? Are we managing their expectations? Have they come here thinking hormones are a magic pill? So what we do, we listen to them, we hear what's going on for them, and then we fill in the gaps. And before we can help, we might need some gaps filling in, so it's a two-way interaction where they are an active player in their own treatment. If they know anything about the medicines, you can have a conversation about that. I always temper it with saying that, the worst you'll get from us is best advice. That's going to be the very least you'll get. And I was going to go back to the way the telemedicine works as well, because I tell a lot of our patients when they're learning about the service, by the time we're ready to do a prescription, we'll know you probably better than any other clinic you've ever been to for anything in your life, because actually it's such a short space of time. You get to know your patient. My care with the NHS was an appointment every 6 months for 30 to 45 minutes. How could they ever have got to know me? We get to know, as they go through our services very quickly, the team get to know them. So I think that's one of the biggest pluses of telemedicine.
I agree, absolutely. I would just like to outline a little bit the aspect that Facial Team really focuses on is not just the consultations, but also like yourselves, the information is provided in a lot of different ways, and the consents are all done. It can be signed telematically. So we have very, very well prepared booklets and flyers, etc., that are shared, and every day we're moving closer to being able to have a more centralized area. That's the aim. We don't have a portal at the moment, but that would be awesome. No? So Dr. Capitán, since you're back after a little hiatus.
I am sorry. Sorry, I was logged out for a while. So excuse me. Okay.
It's okay.
I changed my spot because probably the connection was weak.
Okay, yeah, well, telematic things aren't problem free either.
These are the problems of telemedicine, yeah.
So, and now that you're back, you probably missed out on what Helen and Marianne were saying. So just to put you up to speed again, we're talking about how telemedicine allows us to provide not just the consultations, but also a lot of information. And they were talking about the portal that GenderGP has, and all of the documentation and the informed consents that are able to be done. And what really impressed me about GenderGP is how you even are able to get around, I asked about managing hormones. And, if somebody has to have a blood test in order to manage that, how do you get around that if you don't have a physical location? And especially during a pandemic, when an individual patient can't access labs physically. And I found on your website, which is amazing, you send them pharmacy tests so they can do it at home, which I think is great.
This is awesome. Yeah, this is amazing. I want to ask you, Marianne and Helen, how often do you attend your patients? I mean, probably that you have two different types of patients, correct? Those seeking for counseling, those under hormonal prescription or hormonal treatment. How often do you normally see them?
Well, all the patients at GenderGP are seen like this. This is the model of GenderGP. So we almost exclusively use telemedicine for our.
No, I know, but how often do you?
Oh, I see what you mean. I beg your pardon. So as often as people want, but okay. The interactions, at the beginning, everybody is seen, and then again if they want to, and again if they want to, as many times as they want. And then once they got to know us and what have you, then the interaction is often done by typing. But if somebody wants to book a session with Marianne or any of the team, or if they want to book a session with one of the doctors, they can just go online and just book it. The waiting time is 2 or 3 days. So it's really led by the patient. And patients, in terms of follow-up, obviously follow-up is for life, because this is a medication for life. If somebody wants to take medication for life, and blood tests for life, but actually once someone settles into their journey and their medication is settled and they are happy and they just want to be left alone to live their life. So maybe once every 6 months or a year. So, but we are led by the patient, and that's the most. And I think that's what accessibility is. And because telemedicine has allowed GenderGP to be accessible and affordable and doesn't need a physical location, that means there's been no waiting lists. And if they're too busy, we just get more staff. Train more staff. So so it's a model that works really well. We don't have to get a bigger building. We just have to get more internet connections.
Fantastic. And one of our viewers has mentioned, Samantha, has said that GenderGP has been her savior throughout telemedicine, through telemedicine, because there's a 2-year wait in her country, and the nearest gender services are 600 kilometers away. Spain, I have seen comments from people in Spain also saying that waiting times for the public services can be anywhere between 5 and 10 years, depending on, it's too long. So yeah.
You said at the beginning, Lilia, and this is very important to me. I mean, telemedicine is a real change in the paradigm of medicine. I mean, it is going from local to global. I mean, the medicine a few years ago, you had to go to your local doctor, to your local hospital, to your local services for whatever you need. Right now, you can attend any single person in any single place of the whole planet. And this is really crazy. I mean, this is probably you agree, is a huge change in the way medicine has been understood for the last years. And Marianne, I think Marianne said, it came to stay. I mean, it's something that we are going to see how it is increasing year after year. So normally, and this is something very interesting, and we have many patients that we see once time through Skype, and then they directly come from the surgery. They come for the surgery, which is very, I mean, even to me, sometimes it's something hard to believe, because they have seen you through telemedicine, but they trust you so much. They are so confident in the information you provide, and they have the opportunity to interact with other patients, with forums, with different platforms, that they have it very clear what they are doing, and they come to Spain, they have the surgery, they go back to the country. It's something interesting. Yeah.
And the other thing, don't forget, Dr. Capitán, is the follow-up. You know, people say, well, you know, what about the follow-up? But you know, you could, as a doctor, you can see, if someone's worried about something, you know, a lump or a scar or whatever, you can see it from here. Anything that you don't need to touch. So you'll never be able to, I don't think you'll ever be able to do 3D printing surgery, but anything that you don't have to touch, we can see through video. And that's really reassuring, where in the past, someone, if they wanted you to look at something, you'd have to say, well, you'd have to come and see me. Now that you can say, well, let's see if I can see it enough through the video. You know, send me some photos, send me a video clip, really zoom in and show me, you know.
And of course, I agree, Helen, with that. But of course, we always apply a lot of common sense. And I'm going to give you an example. We, let's say, unfortunately, we are doing more and more redoings. I probably you know what is a redoing. Yeah. Redoing, you have to reoperate something that went wrong in other places or other centers. And this is something that we see very frequently, okay? When the case is complicated, or when the case has to be extremely well analyzed, even if the patient is from Australia, from Canada, or from Taiwan, they have to come for a personal consultation. We need to make a CT scanner, and we have to clinically evaluate the case. And normally the patient understands very well this situation, and they do that. So we have like all the options over the table. If the case is very clear, internet and surgery, perfect. It works perfectly well. If the case is complicated, then personal consultation and surgery, if you can do the surgery. So you have like a very broad sort of things. Yeah.
Yeah, absolutely. The telemedicine is involved in all of the stages, before, during, and well after. And like Helen said, it's a lifetime thing. And in the case of Facial Team as well, we stay in contact and follow up with our patients for definitely 12 months after the surgery, but many times we continue contact even long after that. And one thing I'd like to hear from Marianne at this point, because along all of these phases where we involve telemedicine for various things, stress management is something that is pretty common on our end of things. Is, you know, you can imagine with surgery, people are anxious beforehand, they get nervous, you know, while they're here, and a lot of doubts and things come up afterwards also. So so Marianne, could you tell us a little more about how you see stress management as the lead therapist for GenderGP?
It's all termed as anxiety when they come in the therapy room, And actually, even when we're doing a session over Zoom, anxiety is always prevalent. What we try to do as a counsellor is to get them to keep a perspective. Gender dysphoria is horrendous. I think that the thing that people miss in all of this, they just think when somebody's trans, it's just something they want to do. The feelings of gender dysphoria are agony, and depending on how much pain you're in will depend on the things you want to do to ease that pain. So yeah, they will be anxious coming for facial surgery, or they'll be anxious coming asking for hormones. But what we try to do is get a perspective. Is the pain enough? You know, do you really feel that this is going to enhance your life? And we won't get rid of all the stress and the anxiety, but what we can do is kind of just assuage it a bit, so that they've got enough to motivate them, but not enough to stop them going through it. I hope that answers the question.
Well, you always make me feel really calm every time you explain things like that, Marianne. So I think it works. And just hearing you talk about that agony and the expression on your face, I can see the agony. And I can see the number of people that have shared their agony with you, because it's evident on your face. And I was just thinking back to the person who commented, Lilia, Samantha, and I was thinking, if that agony had to go on for 2 years waiting, because some people kind of perceive that the decision is made yesterday, right? Yesterday I decided I'm trans, and tomorrow I'm going to go for hormones, and then next week I'm going to go for surgery. But it's not like that at all. There have been months and years of anguish and agony, like you explained, Marianne. And then when you're brave enough to go for the very first time to the doctor, it's really important, that interaction to the outcome for that patient. And to be told when it's time to go, you're ready to go to the doctor, and to be told you can't go to the doctor for 2 years. What happens in that 2 years? That agony of waiting for that in that 2 years causes mental health problems. It causes clinical anxiety, depression, stress. So it's really important that doctors make themselves accessible for people. 2 years waiting list is not acceptable for somebody who is in the agony that you described, Marianne.
I would equate it to, if somebody broke the leg and they had to wait 2 years before they got a plaster cast on it, damage is done, 2 years of a wasted life. And let's put this in perspective. It's 2 year wait to be seen by somebody who's going to say, "Are you sure you're in pain?" That's the equivalent. Are you sure? Are you sure you're in pain? Prove it. Prove to me you're in pain. And all you want to do is scream at them, help. Interestingly enough, I was just thinking as well when I was talking before, we talk about the pain of facial surgery, how much is it going to hurt? But actually it's pain management. Well, the question really is, how much pain is this going to save you? Because it's very easy to look at it as surgery, and surgery is painful. But the pain that they've been living with all their lives before that, and if that surgery can empower somebody to walk into the workplace or go and face the family or, whatever else, it's pain management. And I do think that's lost in a lot of the conversations that we have about transgender healthcare.
Another thing that comes to my mind hearing you, sometimes, and this goes out a bit, Lilia, from our telemedicine objective, and I think it's interesting. I mean, how important is that the different specialists within the trans health we interact between us, because normally the human being normally try to isolate, to classify every single stage like something very individual. So you have the facial surgery, and you have the hormones phase, and then you have the bottom surgery, and then you have the counseling. But everything is a whole. And from the very beginning to the very end, the patient has to be totally followed up by someone. And that's the reason it's important that facial surgeons, we interact with psychotherapists, or with the doctors in charge of hormones, or with the whoever. I mean, and this is something we have to establish, because right now, I don't know your opinion, but right now it's like very separate, like very there are no interaction between us. And this is something crazy. I don't know if you agree.
I couldn't agree more. And, you know, we need to rewrite the rule book on lots and lots of things. We need to go right back in history and rewrite the rule book on gender, because we got it wrong. To segregate people as men or women based on what they look like at birth was wrong. It's going to be really difficult to unpick that. But actually, I think as medical students, I don't know about counsellors because I'm a doctor, so that's the bit I know, but medical students, to put us either in the surgery clinic or the medical clinic or the the dietitian's clinic, it's wrong. Everything should, we shouldn't separate so much. And my second eldest stepson, he's a dentist, and they don't do anything below there. It's almost like one day somebody decided that there should be just this bit which does dentistry, and it's only from the neck up, and anything from the neck down they're not allowed to do. And it's like, why? That's so stupid. You know, this is a human body, and we should be mixing up the skill mix much more and talking. And actually, what telemedicine allows us to do is to do this. You know, when else would you have been able to have such a conversation with someone like Marianne, someone like me, and us with you? 20 years ago, that just wouldn't have happened. But today it can happen.
Yeah, I like it. Yeah.
Mm-hmm.
Absolutely. I see telemedicine nowadays as it's creating a more continual line of care, right? So we're closing the circle, the gaps in between, and we're able to provide higher quality attention, really. Marianne, on the topic of anxiety, it also reminds me of the emotions that a patient goes through when they come here for FFS. So there's this roller coaster, right? And as a gender therapist and Dr. Capitán, as a FFS surgeon, what do you say to these patients who are going through this and managing their emotions around transition surgeries?
Marianne.
I think the starting point here is, and this links to what we were just talking about, a joined up service. I'm a person-centered counsellor, so I don't just look at, oh, they want to get hormones. We look at the journey. Where are they on the journey? Where do they want to be? You know, some people just want to experience hormones. They've had the whole life, you know, waiting for this moment. And other people, you know, they're already living their lives, living the truth. So I think if you're talking about getting to the point where they're having facial surgery, you know, the reality is there should have been a journey to that point. Now, for some people, it might have been a life's journey and they've got to 30 or 35 or 40, whatever age they're at. And it might be the start of the transition, but there will have still been a journey to get to that point. And for other people, and I'm sure you know, they'll turn up and, you know, they've got the whole family with them, and you know, this is the time dry. So I think the only way, again, going back to the emotions, you know, I think the end goal of the outcome that they want is the main focus. And I think a lot of the emotions are attached to, not am I doing the right thing, but, you know, can I trust the surgeon? Can I trust these people to help me? When people come to GenderGP, the first thing we really try to do is instill confidence that we know what we're doing. There's a lot of bad press out there, as we know, about any transgender healthcare. So the first thing we do is connect with them. And I think that's what you're doing with the telemedicine in the very early stage, making sure this is right for this person. You know, do they think that this is the thing that's going to make them a woman? Is this surgery going to make them a woman, or are they already a woman? Are they asking to look like somebody else? You know, is that right? Would we feel comfortable with that? So I think that's what I would say about the management is giving them confidence, connecting with them, and helping them to understand that it's right for them at this time.
I really like what you said about managing expectations, Marianne. You know, it's not just about managing emotions, which is important, obviously, but do you see a lot of people who are having questions about their expectations in regards to the impact surgery is going to have on their life? And I don't just mean facial surgery, I mean all different kinds of treatments.
I think I don't see this a lot, but I know in other areas of transgender healthcare, it's definitely going on. People go to surgeries because they feel pressured to. So if we're going to say to a trans woman, we have an expectancy of femininity, and that means that you've got to have perfect face, a vagina, you know, double D cut breasts. You know, you'll go and have them surgeries for all the wrong reasons. And that's my concern, where when it's done badly, we're talking about informed consent. That's what we do at GenderGP. We make sure they're fully informed, and that we're informed, that they understand what they're doing and what the expectation of that is. So yeah, I would imagine it's the same with the facial team, that you know, you don't just want to operate on somebody because they say they want an operation, that you just get to know them a little bit, you know, and not make them validate the gender, just maybe just double check that this is the right time for them to be doing this and what the reasoning is behind that.
Yeah,
I'm going to have to jump in because I can't stop talking any longer, because this is so important. Because if you look at the criteria for surgery, the criteria for gender affirming surgery, according to our guidelines, and it continues to this day, and I hope the WPATH, when they rewrite the guidelines, are going to put some consideration to this. They're all about, is this person trans? And it's almost, we forget the bit that is this the right operation for the patient? They are trans because that's what they're telling you. They just need to tell you that they're trans, and that's fine. Believe you, that's fine. That's that bit done. Right. Now let's talk about this operation and what it means to you. Is it the right time? Why do you want it? Why now? Who's suggesting it to you, or is it coming from your heart? What do you want the output to be? Is your output realistic? I saw someone on Facebook the other day and they were saying, I want to look like this. And I have to say the two pictures couldn't have been more different. And that expectation there's such a big gap there. And if we as clinicians on the consent form could spend less time validating the gender and more time on exploring the hopes and expectations, I think we'd do a much better job.
Yeah, this management of expectation is is keystone for us. I mean, let's say is vital, and Lilia knows it, because at the end of the day, and this is very important to transmit to the patients. I mean, we are not changing their face. We are not giving them a new or another face. It is totally wrong. I mean, they are just giving the opportunity to find the true identity, the true gender they feel inside. So for whoever who appear or to look like someone else, we are not the people. I mean, this is not the goal of the surgery. I mean, keeping the identity, the core identity, not related to gender, is essential. So maintaining a very natural result. So that's the reason it's so important to establish the difference between cosmetic and you know, extreme makeover surgery and facial feminization. I mean, we are doing something very specific and very concrete. We are just removing those parameters that can be read as masculine, but we are not changing the people. We are not changing the person. And this is vital to understand. Otherwise, is where problems appear in the future.
I'd like to make a parallel here, because before Marianne was talking about how in therapy with trans clients, it's not about eliminating anxiety or eliminating depressions. It's about discovering ways to manage it. And equally, the parallel here with FFS, I think, is that it's not about creating a new face. It's not about eliminating your face and giving you a new one. It's about working with what you have and reducing the masculine aspects so that the bone contours are as similar as possible as how they were before puberty, when testosterone changed them. Correct. So I think that's a really interesting parallel here. We're on common ground here on telemedicine. And how that needs to move forward. We're on common ground here about realistic expectations. So now I think it's time. We've been going for just over an hour. I'd like to hear what your takeaway messages are. If you'd like to go first, Helen, what do you want our listeners to take away, the key message for today?
I'm going to bring in a slightly new concept. And I think we haven't talked about youngsters. And youngsters are really important. Youngsters are tomorrow's trans adults. And I don't know how old Samantha was, but Samantha was having to wait 2 years. In 2 years, testosterone does a lot of damage. And I'm hoping, Louis Capitán, that one day we won't need facial feminization surgery because we will get trans healthcare right, and people who don't need to go through the wrong puberty don't have to. So we don't need to correct things that shouldn't have happened. And I think we're talking a long way in the future, but I'm hoping that one day telemedicine will be in normal public services, and so you won't need private healthcare services such as GenderGP, and it will be at a timely time so that we don't need corrective surgery such as facial feminization. But in the meantime, I think that I join you, Dr. Capitán, that I'm delighted to help this community. They were such a worthwhile community to be a part of and to be welcomed into.
And Marianne, how would you like to encapsulate what you want listeners to remember from today's discussion?
Just how great telemedicine is, actually, and the reach that we can have. And it doesn't matter where you are in the world. It doesn't matter where you're sat, as long as you're safe to talk, not driving. You can go out and find the right surgeons. You can go out and find the right clinic. It doesn't have to be in your hometown or within driving distance. And to me, that as a trans woman, I want to put this into context. Years and years ago, this was beyond anything we could have ever dreamt of. The fact that we can access transgender healthcare from the comfort of our own home is fantastic. It's mind-blowing. So I'm hoping the listeners have got a sense of that.
I think they do, because a couple of people, we have people here from the UK, from Switzerland, from other areas, and many are commenting on how they've had to wait so long, and a couple have also mentioned that GenderGP has literally saved their life, and to quote, their marriage. So yeah, so I definitely commend all the work that you're doing. And Dr. Capitán, do you have a takeaway message for us today?
Sure. I would say that thanks to telemedicine, the patients, they have the key to knowledge. And I always repeat the same to my patients. The better informed you are, the better prepared you are to take your decision in terms of surgery, hormones, of counseling. And this is a big power. So you have your whole planet through your computer. So if you use it well, you have an unlimited source of information. Of course, information can be good information or bad information, but if you have the capacity to filter that, to go to the good information way, is extremely powerful. So use the telemedicine, I would say. Yeah.
One of our viewers is saying that in France they're lagging behind. So I think Aurel, I think many countries are lagging behind. So we're all doing our best here at Facial Team and the GenderGP to try and pick up where others may be lagging. So thank you very much, all three of you, for your takeaway message and for participating today in this very interesting discussion. It's been amazing for me personally. I would like to share with our viewers a link here we're sharing down below to the GenderGP portal, and lots of information on different aspects of transition. And don't forget, especially, I was peeking around the GenderGP website, and I especially liked the petition. There's a GenderGP petition. Please sign now for this petition. It's important for trans healthcare to move forward. So share it as well on your networks, please. So thank you everybody for joining us. Please, viewers, put comments in And down below, give some claps to our speakers, our special guest today, Helen Webberley of GenderGP, the founder, and Marianne Oakes, the lead therapist for GenderGP, and Dr. Luis Capitan of Facial Team, the founder and director, and FFS surgeon. If you're an ally, if you're a healthcare professional yourself working with the LGBTIQ+ community, please show your support now. Send messages to your legislators, to your MPs, tweet the powers that be, and do whatever you can to support the charities that are continuing their work so that basic human rights like healthcare access for our community are respected. Stay safe, everybody. Stay healthy. And remember, what is it? Your healthcare matters. Thanks again for joining us. Over and out.